I'm Dr. Leigh Nadler at St. Clair Hospital. I'm going to talk with you about the bowel prep for surgery and colonoscopy. I'm going to first start with colonoscopy preps. The prep in the morning is a little different than the prep in the afternoon in terms of the time that you take the bowel prep. We usually use two types of bowel preps. One is called soup prep, and the other is Clen-Pick. These are two smaller volume preps, and you have two bottles, and you take them at two different times. If your colonoscopy is in the morning, then the day before the procedure at 3 p.m. and 9 p.m., you're going to take the prep. And you will take this bottle, pour it into this container, which comes in the package, and then fill this with cold water up to the line, and then drink it down. Try to drink it kind of quickly. It does not taste very good, but it is very effective and works very well. It provides an excellent bowel prep so that we can look for polyps in the colon. If the prep is not good, we might miss small polyps. After you finish the prep, you should drink another couple of cups of cold water or clear juice. Don't drink anything that's red, orange, or purple, because as this comes out, it might make you feel that you're bleeding. So you're going to repeat the same prep again at 9 p.m. Now, if your colonoscopy is in the afternoon from 1 o'clock on, then the first dose of this prep should be at 7 p.m. the night before the procedure, and then repeat the prep again at 6 a.m. the day of the procedure. You should not drink any liquids, nothing clear, for at least 5 hours before the colonoscopy, or the anesthesia team might cancel your procedure. You'll report to the third floor endoscopy unit, and you'll be checked in, and they'll bring you over to the endo unit. We'll do the procedure, which takes about 10 or 15 minutes. They're going to watch you for about a half hour to an hour after the procedure, and then you can go home. Someone needs to be able to drive you, since you're going to be sedated for the procedure. You should not drive that day. You shouldn't work after the procedure. The following day, you can do whatever you want, eat whatever you want. Now, it's usually best to avoid nuts and corn and seeds for 3 to 5 days before the colonoscopy, so that the prep works better and that we don't see any of these seeds in the colon when we do the procedure, because they can clog the colonoscope. Also, there are certain medications that you might take that could make you prone to bleed if we remove a polyp or take biopsies, such as Plavix, Coumadin. You should have discussed this with the doctor before your colonoscopy to determine when to stop these medications. If you're diabetic, you should speak with your primary physician to determine what to do as far as insulin. The day of the procedure, if you take oral diabetic medicine, you should not take it in the morning. You should take your medicine after you eat, once the procedure is completed. The other type of prep is called New Lightly or Go Lightly, and that is a 4-liter prep. It's a big gallon jug. And that prep would usually be started the day before the colonoscopy at about 3 o'clock. You would fill up a 10 or 12 ounce cup and drink that every 10 minutes or so until you finish the prep. That's a larger volume prep, but sometimes the smaller volume prep does not give you a good bowel prep, and we might need to repeat it with a larger volume prep. If that's the case, then that's the time that you would start that prep. If you have any other questions, just call our office, 412-572-6192, and we'll be happy to talk with you and answer any questions you might have. Thank you for watching.